So I want to talk a little bit about the Age-Friendly Cities project and the work that we're doing here in the region. And it's important to start by stepping back to 2006 when the World Health Organization started the Age-Friendly Cities project. Originally, they had seen the dual trends of not only aging in the world, but also the urbanization of the world. And older adults living in urban areas was a very important thing to focus on when it came to health and well-being. So in 2006, they started a project called the Age-Friendly Cities Project, which included 33 cities from 22 countries across the world. When they invited us, we were the only U.S. country to be involved in that original research. In 2007, when we finished with our research, we went to London to share our findings and to be part of a team to talk about implementation and next steps. And were provided that opportunity to continue working in the network as it continued to grow. So in 2009, we applied for membership to the global network of age-friendly cities and communities and started a process that included doing an action plan or creating an action plan that would move forward at the time areas of our domains that consisted of about 8 different areas that included housing, transportation, outdoor spaces, and buildings, respect and social inclusion, communication and information, volunteering and civic participation, communication and information, although I think I said that already, community support and health services, and then also what would be employment issues. So here in the Portland region, we had the opportunity to begin working with an advisory council that consisted of members from a number of different areas, from public, private, and voluntary sectors to guide our process. We had originally chosen the city of Portland to do our work, important because we were able to look at policies that pertain specifically to a geographic area and that were governed by the city of Portland's bureaus and offices, such as the Portland Bureau of Planning and Sustainability, Bureau of Transportation, and Housing Bureau. So in our work, we've essentially detailed action steps along 10 different domains that was an outgrowth of the original 8 domains, to try and understand how we're able to improve active aging, which is engaging people in social environments, and also trying to think about the built environment and the relationships between economic and social issues and an aging population. And one of the things that's really important to understand is that older adults in our region do have some disadvantages, and there are equity issues that exist, especially older adults who may come from different backgrounds, lower SES socioeconomic areas, different races and ethnicities. And so it's been very important for us to take a look geographically, but also across these different lines that do exist, to try and figure out how to improve the quality of life and well-being of these individuals. So as part of our Age-Friendly Cities initiative, what we did in 2012, actually 2013, is we had an action plan ratified by the City of Portland by resolution. So City Council voted unanimously to adopt this, and we started the process of implementing that plan. So the 3 initial areas that we focused on were civic engagement, the second one was housing, and the third was economic development and employment. And so we've been working very hard over the last year to get these projects off the ground. The first of our 3 project launches happened last week. It was an event called What Are Old People For?, which was designed to incorporate a book that was written by Dr. Bill Thomas with the same title, What Are Old People For?, to get people thinking about intergenerational opportunities and to get the thought of older people as having needs and a declining kind of trajectory out of folks' mind, and to get them starting to think about the assets and opportunities that do exist within communities, and fostering interdependent and intergenerational opportunities as well. So we see things like mentoring, opportunities for discussions and collaborations, and learning across the life course as critically important for moving this agenda forward. We understand that there are a number of organizations in town, including AARP, Elders in Action, but also the educational systems and folks who work with youth and folks who are in college as well as older people, to try and connect them in some meaningful way as we move forward. As an outcome of this initial launch, and as a part of a year-long program that we have given a discussion guide for the community to engage in conversations with older adults, and to think about what would be intergenerational program development. So you have three ways of maybe thinking in general about intergenerational programs. Maybe older people serving younger people serving older people, or older and younger people coming together to serve another population. The second of our two initiatives, the housing initiative, has been slow to get off the ground in that we have our first event coming up in October of this year. We're looking to host a breakfast forum with building industry leaders, folks who are working in design and development, who understand what it means to put together developments that would be good for or specifically designed for older adults. And we were asking questions at this upcoming forum of what they see as opportunities and barriers for implementing the action plan, taking a look at how we can develop educational materials that would be helpful not only to the developers but to consumers of housing. For instance, if you were an older person moving to Portland, where would you go to find the right community? The community that would allow you to age in a healthy manner. And if we provide people with those resources to get to the right place that will allow them to age over time, that makes a lot of sense. In addition to that, we're working on informing policymakers on good ways to change, whether it's codes or incentives, in moving forward age-friendly housing and trying to look at this as a potential opportunity for innovation. In addition to that, we're taking a look at nonprofit organizations and community organizations and trying to understand how folks can age in community and age well over time. And this is critically important because the public sector, government services and policies only go so far in supporting people as they age over time, but really neighborhoods and communities are critically important for allowing us to age in a healthy and well manner. And then the third area of emphasis, at least the initial three areas of emphasis to close that out, is economic development and employment. And one of the things to understand is that we found in our original baseline assessment in 2006 that there was ageism that existed in Portland's employment industry. So not only people who are 65 and older, but even people as young as 45 who are seeing some type of discrimination. And we understand through the literature and our research as well that older adults have quite a bit to offer to employers and to as employees of various organizations. In addition to that, economic development is something that is an opportunity that we need to look at. So when we look at the aging of the baby boom population, there are a number of older adults who are entering a market that is desirable for people who have goods and services that they're trying to sell. We understand the importance of connecting folks with those markets, but also understanding that there's a social responsibility that exists on the private side. So we're trying to understand not only how to inform businesses, how to market to older adults, but what those needs are, what the opportunities are. For example, we see Portland as a place that people would want to come visit if they were older or had some sort of a disability, because we have good infrastructure, because we have good transit systems. How do we begin to improve those systems and create an age-friendly visiting Portland, an age-friendly place that people could see as a great destination if they were in not only in a wheelchair but had a walker, or if they were pushing a stroller. Age-friendly is an opportunity to look across the life course, not just at younger individuals, but at older people as well. So as we move forward in our initiative here in the region, we're taking a look at two additional areas that will take off in the next year. The first is active transportation and understanding how our physical environments, places like not only downtown, but other regional centers that are being developed to be healthy and connected communities, can be improved, and specifically look at the details that would be good for an older person to function within that environment. For example, we might see bench design, whereas before there were no criteria for what was a good bench for an age-friendly outcome. Now we understand that having a back, having arms, having a place underneath the bench that would allow somebody to get up should be a part of the design process. So we're working with local governments and with the practicing community as well to implement these types of guidelines and procedures. And then the final piece of the initiative that we're working on is a public health piece. And so we see this as critically important. Oregon is looking to become one of the healthiest states, if not the healthiest state in the United States. And it's critically important that we look at older adults as a part of that. possibly our biggest demographic shift that will happen over the next 20 to 40 years is the aging of our population. So if we don't consider that as part of our effort to become healthier or the healthiest state, then we'll be missing the mark.